Hey guys, Tony Maritato here, licensed physical therapist. So I just had a brand new patient finish a first-time initial evaluation following a right rotator cuff repair with a biceps tenodesis. Basically what happens is when the surgeon repairs the rotator cuff and includes the biceps tenodesis, the patient is not allowed to actively bend or flex the elbow. With a normal rotator cuff repair that does not involve the bicep, we're usually going to do some elbow flexion extension, some wrist motion, but in this case, we're not allowed to do that. So my home exercise program that I prescribe for this particular patient is a combination of three things. Really simple. The first one was a simple pendulum exercise. So you've seen people do pendulums. They usually do pendulums incorrectly. What happens is the patient will try to move the arm with the body stationary. That is not the right way to do a pendulum. If you think of a string with a rock on the bottom, I have to move the top and the rock will swing in rhythm with the motion at the top. To do a pendulum correctly, you relax the shoulder to the best of your ability, you move the hips, and the hand will swing in rhythm and timing with the hip motion. It should be comfortable, it should be pain-free. The goal of the pendulum exercise isn't motion. The goal of the pendulum exercise is to relax the shoulder joint so we create a little bit of space, which draws in the synovial fluid and kind of flushes out the joint, helps to move some of the waste products out. So in this case, we did pendulums. We did them in what I call a semi-supine or prone position, not supine, prone position. And basically, so the patient was leaning forward. If they could go to a full horizontal. This gets the person to 90 degrees. That was exercise number one. Exercise number two, because most patients will develop some tightness through the bicep, she's not allowed to flex the bicep. So we use the non-surgical hand. We lace the fingers. My non-surgical, in this case my left, is flexing my right. I encourage her to keep the elbow close to the rib cage, and we're going to do about 10 to 15 of these elbow flexes so that we can start pumping some of these muscles, move some of the fluid out of the rest of the hand and the lower extremity. The worst part is if the fingers get super tight, kind of sausage fingers because of the swelling. This exercise is going to help to move or relieve some of that tension. And then the final one that we did was, again, with the fingers laced, elbows close to the body. We would do an elevation, so I'm shrugging the shoulders up. I retract or roll the shoulders back and then let them come back down slowly. What happens is we're not moving any of the musculature related to the rotator cuff. We're not moving the arm away from the body. We're simply elevating the upper trap, the muscles at the base of the neck. We're going to contract them. We're going to roll the shoulders back and we're going to let them down slowly. Something like this could be done with the sling on, with the sling off. These are the three exercises that I'll typically prescribe next to the first week or 2 weeks post-op, simply because I want to reduce some of the guarding, some of the tension. I want to make the musculature around the repair feel a little bit better, and I want to build some confidence in the patient's central nervous system so that, you know, when it's time to start moving the arm a little more aggressively, there's no resistance to it. It moves very easily. So guys, if you have questions about post-op rotator cuff repair or any surgical procedure related to the shoulder, post them in the comments below, and I'll catch you on the next video.